Good evening. I'm going to be talking about something interesting, an interesting head topic that many people don't know about except those in the health profession. It is interesting because it is life saving once you can get yourself sorted out. It's called obstructive sleep apnea, abbreviated as OSA, obstructive sleep apnea. And it has to do with obstruction of your airflow, and this results in apnea. The meaning of apnea is paused breathing. Paused breathing. Your breathing stops momentarily, then starts again. Then there's also what we call hypopnea. Hypopnea. Hypopnea is slow or shallow breathing. So for those who have obstructive sleep apnea or OSA, they could have this. Have you ever been told by your partner that you snore at night while you're asleep? Have you ever been told by your partner that sometimes you choke when you are asleep or you go into a post breathing state? Or do you wake up in the morning and you feel like going back to bed? You don't feel refreshed. You feel tired. Or while you are driving to work, or you're driving in the morning or during the daytime, sometimes you sleep on your steering, what we call dozing off in Nigeria. Or you veer off the road sometimes and you find yourself in the bush, or you've had accidents before. You may need to go check yourself. Check yourself with a physician. You may need to get to the nearest sleep clinic and conduct a test for obstructive sleep apnea. The sleep clinics do such tests, and it's called polysomnography. This is very, very important because some people have lost their lives and they didn't know why they had those challenges, why they had those accidents, those incidents. They really did not know. In most cases, it could be due to obstructive sleep apnea. You find obstructive sleep apnea in those people who sometimes they could be obese. They could have large neck. Some would have jaw deformities, large tongue, or uvula. Uvula is the long, fleshy tissue that you see at the center of your throat, like hanging down. It could be very large and it could tend to obstruct your airflow while you're sleeping. The commonest cause is due to what we call a narrow neck. And there are risk factors for obstructive sleep apnea, and such risk factors would be those who have sleep deprivation or who sleep excessively during the daytime, obese people, like I've said, those who abuse alcohol, those who smoke cigarettes. Then, most importantly, with every pathology or condition, a positive family history of obstructive sleep apnea could replicate itself in the family, in the children, in the offspring. Then those with heart failure and hypertension, those with those who are middle-aged, like in our age group, 40 to 70 years of age, they could be prone to that. And I've talked about the symptoms before. The symptoms are those of fatigue, not feeling refreshed in the morning after you wake up, being told by your partner that you snore excessively, and being told by your partner that you choke occasionally while you are asleep. The other thing I want us to know is that there are some associated conditions with obstructive sleep apnea. That's why we should treat it. It's been found to be associated with some level of dementia. It's also been found to be associated with atrial fibrillation. It's been found to be associated with heart failure and some stroke and some heart disease, right? So it's important that if you have this condition, you see your physician so that you're taken to the nearest clinic and you're sorted out. And you can also have it in children. The treatment is by way of using the CPAP machine. It's commonly available. could cost about $2,000, but you could get cheaper ones in Amazon to get. And with the use of the CPAP machine, you would actually do well. Your sleep will be improved. And the people who do the sleep study, they measure an index they call the apnea. They call it the apnea index, AHI, and if you have values of greater than 5, is symptomatic of or diagnostic of obstructive sleep apnea, and the CPAP machine would readily help you. One important thing that you should take home from here: if you have obstructive sleep apnea, until you start using your CPAP machine, don't drive, please. Get somebody to drive you so that we avoid the consequent or attendant complications of accidents and deaths that will result from that. Obstructive sleep apnea is real. If you have a friend who sleeps on the stairway, veers off the rules, snores at night, chokes while sleeping, tell that person to see the doctor. Thank you for listening.